We're in the month of March now, and March marks National Kidney Month. About 37 million American adults are affected by chronic kidney disease.
Joining us this morning to discuss how to be proactive about your kidney health is Dr. Jessica Coleman and kidney health advocate David Rush. First of all, thank you both for joining us this morning.
Thank you for having us. Happy to be here.
So Dr. Coleman, we'll start with you. What is chronic kidney disease and who is at most risk?
So chronic kidney disease is a disease that affects the normal mechanisms of the kidney function, and it's actually pretty prevalent. Unfortunately, up to 37 million U.S. adults are suffering from this disease state, and sadly only 10% know it. So it's a disease that's very easily identified through routine annual physical laboratory data. Just a blood test and a urine test will give your healthcare provider an evaluation of the percentage of your kidney function, what we call the GFR, and if there's any protein in your urine. Those two key items will tell us if you're at risk for kidney disease and progression of your kidney disease. Also will tell us if you're at risk for any complications of kidney disease, things like high potassium or hyperkalemia. So I appreciate the opportunity, especially at the start of March, to come on here and give people a better understanding of really how to take better care of themselves.
Sounds pretty easy to take that early action. David, I want to talk to you in a second, but doctor, one other thing, why is it so important to take this early action with your kidneys?
Absolutely. So as with most disease states, early identification and detection can really change the trajectory of your course. And it's an exciting opportunity where we have the potential to prevent progression of kidney disease in the world of kidney disease at this point in time. And again, prevent complications like high potassium that can be silent. And unfortunately, sometimes the first symptom can be death. There are, of course, other symptoms we can see. But again, your healthcare provider can really help to individualize your treatment course just with early detection.
Doctor, thank you. David, can you please tell us about your personal experience living with chronic kidney disease?
Sure. Thanks for having us on here. Just started in high school, regular routine checkup for football. I went to go get checked up for football, took a urine sample, and it was protein in my urine, came back, was then sent over to a specialist over in New York, and they found scarring on the tissue of my kidneys. Of course, being 16, 17, you're living invincible. You think that, you know, you're not going to get sick and nothing can happen to you. I left for college and just lived a normal college life, came back home. My then girlfriend, now wife, took me to get a physical done, and that's when all my numbers came back out of whack. My creatinine was high, my blood pressure was over, and everything just seemed to be crashing down at that point. Just wasn't sure what was going on, but it happened to be chronic kidney illness. And I actually started dialysis not too long after that, and did home dialysis, was transplanted one time by my brother, ended up losing that in 2017, and went back on home dialysis, which I'm currently on now. But now I'm doing advocacy work, just spreading the word, like we said here, and just trying to help others be proactive in their health and take care of themselves as best as they can.
Yeah, I mean, what is that message, David? I mean, what do you tell young folks out there?
I tell them, man, be proactive. You know, listen to your body. You know, just because you're young doesn't mean that you're healthy. You know, I know you're eating what you want, doing what you want to do, having a great time, but get those checkups done. Go get that blood work done. Get those physicals done annually, and let them tell you just from those two simple things what's going on in your body. If you feel something, say something. You know, develop that relationship with your doctors. Ask questions. Get the knowledge as well. And you can also get more information on unfilteredkidneyconversations.com, and also you can follow my journey on there too.
It's very simple.
Yes,
Yeah,
David and Dr. Coleman, thank you so much for that incredible information joining us this morning.
Thank you.
Thank you.
And be sure to go to clicktohouston.com/scene at 7 for more on this as well.